So we were discussing, I hope everybody joins in very fast, though I am today about 3 minutes late. So let us discuss today something more about case taking and something more about how to ask and what to ask in case taking. And it is always said that sometimes, if you get a very important and a very three-marking non-verbal communication, I'll share some cases with you also, it becomes a very important prescribing symptom in that remedy. For example, in many cases you must have seen that a patient of platina, if you have ever read platina, of course, platina is well known for its symptoms of superiority complex and ego and pride and the sensitiveness and the hyperesthesia of the female genital organs. But the most important symptom, now sometimes in case taking it is possible that the platina patient might not be able to share the symptoms of vaginismus or excessive sexual desire, might not be able to share. But what happens, if you ask the position of sleep, immediately the associates or the patient will tell you, because that is absolutely a non-verbal communication. And a very interesting sleep position of platina is a platina patient sleeps with legs wide apart. Now with this symptom you can never go wrong, because this is a symptom which the body or the constitution is trying to share with you. When the patient tells, I am depressed, I have grief, I have humiliation, I have sorrow, I have dominance, it is his interpretation. What can be right, what can be wrong? If it is your interpretation also, it can be wrong or right. But when the body tries to show something, it is not wrong because it is seen in the patient. So platina patient has a very interesting symptom, the position of sleep, that the patient sleeps with legs wide apart. You can enter the case and then ask few leading questions and you can immediately get that remedy, platina. In the same way, there are certain positions where the patient, one patient came to me and the patient told that my daughter sleeps with legs, one leg sticking to the wall and one leg down. Very strange position, very strange position the patient has during sleep. And if you repetize this case, if you see the position of sleep, then you will see a very, very interesting remedy, a very, very important remedy, and a very, very remedy which is not so indicated in a day-to-day practice, and that is plumbum metallicum. Because we only know something about plumbum metallicum relation to spine or the constipation, but or the metal symptoms, but this symptom that the patient has strange position while the patient sleeps. Now these symptoms basically, which I call as a non-verbal communication, where the body is trying to communicate or the body is trying to show that I am this remedy. For example, if you go see when the patient says that the arms, hands, nape of the neck, the patient is keeping here and sleeping. This is again a very, very interesting and a very, very important remedy, and that is Naxonic. So welcome Dr. Palak, Dr. Indrayani, Dr. Mayuresh, Dr. Sunita, Dr. Anja Smith, Dr. Kocher, Dr. Alexander. So these are non-verbal communication which you can never miss, which you can never go wrong, because it is absolutely black and white in front of you. And the position in sleep, you can never think that I'll sleep only on this side or that side. It happens automatically. For example, the patient sleep that I can sleep on the back only. Only I can sleep on the back. When the patient says that when I sleep, I get up in the same position, and a very interesting symptom of a very, very indicated remedy, that is ferrum metallicum. So these are the very, very few examples of non-verbal communication, because yesterday I had a chance of first time taking an offline seminar. So it was a beautiful seminar, and we discussed platina. And when I discuss this symptoms of platina, that the patient has superiority complex, sometimes it becomes difficult to make the audience understand. But whenever you say that the position sleeps with legs wide apart, immediately platina comes to our mind. So these are non-verbal communication in relation to the sleep. In the same way, it is said that there are a lot of symptoms where, like it is said that eyes never lie. And whenever you see a patient, whenever you see a patient and something is very special about the eyes, you can immediately get the remedy. For example, if you say redness of the eyes or XYZ of the eyes, but when the patient comes in front of you, sometimes what happens, there are something preconceived notions of remedies in our mind. That's why we fail. For example, the discoloration of eye is reddish and you can see the enlarged blood vessels. And immediately 9 out of 10 doctors would prescribe one remedy, and that is which remedy? Where the eyes have discoloration, that is the blood vessels you can see in the eyes which are enlarged and reddish. So most of the time, what is the remedy that comes to our mind? Anybody? Most of the time, the remedy which comes to our mind is, anybody? Most of the time, the remedy which comes in front of our mind. Now we are talking about non-verbal communication that has given me a lot of good results or entry point in a lot of cases. Dr. Madan, Dr. Balwarka, welcome. So it is said that whenever the eyelids, the blood vessels appears enlarged and the eyes appears reddish, you can see the vessels, the veins, the network, the meshwork of veins in the eyes. Which remedy comes to your mind? Anybody? Which remedy comes to your mind? Can COVID nosode be given to the patient during COVID? Yes, you can give that nosode during COVID also. Yes, you can give that. So which remedy I am talking about? Can we have some answers? Where you can see the eyes, the veins enlarged in front of us. The eyes appears reddish. So most of the time, which remedy we think about? Anybody? Belladonna. Yes. So most of the time, we think about belladonna. But if you have studied Aesculus hypocastinum, Aesculus is the only remedy that has discoloration where the blood vessels feels enlarged. Aesculus. And it is very well said in the Kent's Matermedica, hemorrhoidal eye. Hemorrhoidal eye. So that's why it is important to first understand the non-verbal communication, then understanding what is written in the Matermedica. Don't be prejudiced. Always have in your mind aphorism number 6, that is the unprejudiced observer. So think about Aesculus. Or whenever the patient says, see, when a patient of migraine comes to you, you have a lot of symptoms common like throbbing headache and pulsating headache, squeezing pain, twisting pain. And the patient says that I cannot bear a lot of sound, lot of smell, touch, noise. Now these symptoms become very common, in migraine. But the patient comes and tells you, or the assistant comes and tells, sir, whenever he has migraine, he will have red eyes and headache starts. So this is the body's way of telling you that I have a problem where my eyes become red. After that, headache starts. So which remedy comes to your mind? Anybody? Believe me, these are a very important, what you call, non-verbal communication that everybody must know, so that in a case where you find difficulty in entering the case, you can enter the case through these non-verbal communications. Yes, so which remedy I am talking about, where the patient says कि जब भी मेरे को हेडेक होने वाला होता है, मेरी आंख लाल होती है और फिर हेडेक होता है. Anybody? Redness of eyes before headache. Simple. Which remedy comes to your mind? Anybody? No answers today? No answers today? What are the remedies can we think about when the patient says that whenever headache starts, first the redness of eyes, then headache starts? Which remedy comes to your mind? Anybody? Cuprum metallicum. Okay, anything else? I think there are no answers on the Instagram also and no answers on the YouTube also. But see, you can always at least think about some remedy, because when the patient is sitting in front of you, and when I'm teaching something or when you're learning something, it is altogether different. When the patient is in front of you, then you have to give the answer, you have to prescribe the simillimum. So yeah, the remedy is either phosphorus or sulfur. These are very important remedies where the patient comes and, phosphorus, sulfur, when the patient comes and tells you the redness of the eyes before headache. Or, for example, again a very important, phosphorus, sulfur. Again a very important symptom when the patient comes and tells you that my taste has become bad. My taste has become bad, and sometimes I taste salty. Sometimes I taste sweetish. Yesterday I ate something sweet, but after some time I had a very bitter taste in the mouth. Now this symptom a patient can never lie. This symptom a patient can never lie. So these again symptoms becomes a very important symptoms to enter the case. Are you getting me? These are very few and important non-verbal communication. Like for instance, I had a case where the patient used to tell me, I feel as if my taste is like, whenever we eat some iron thing, no, metal, iron like taste. And immediately I knew four, five remedies, and I prescribed a very interesting remedy, and that is Cedron. So unless you know this exactly what the body is trying to tell you, you will not be able to enter the case easily, because these symptoms basically are what I call that the body will never lie. Or when the patient starts speaking in front of you, the most easy thing to understand is the voice. When the patient starts speaking in front of you, and you feel, why is the patient so much shouting and talking? When he speaks also, it feels as if he's shouting. So his speech is very high, voice is very higher, and then we immediately get some remedies like stramonium, like belladonna, like rumex. Or sometimes the patient says something and you cannot hear it, and then immediately you have to understand this patient is a patient who basically has low type of voice or loud type of voice. These are very important nuggets, I would say, that will basically help you in understanding a case, and then will help you in prescribing through these non-verbal communications, which I had a lot of queries. Millie Lotus is there, yes, which I had a lot of queries in my WhatsApp group and the Facebook and all. In the same way, it is not always sleep or taste. Sometimes whenever the patient comes and tells you, sir, whenever I'm emotional, मैं जब भी थोड़ा इमोशनल होता हूँ ना, मेरे को तकलीफ शुरू हो जाती है, मुझे हाथ पैर दुखना शुरू हो जाता है. Whenever I become emotional, something has happened wrong, something has happened, I become emotional in general, I start getting pain in my extremities. Or I was normal while taking the medicine, but suddenly what happened, I was expecting my child to do this, and he did not do it, and I felt emotionally very bad, and my pain in the limb started. Then you try to repeat the constitutional medicines you have given, it does not work, because it is an acute exacerbation then because of emotions. So immediately, which remedy should come to your mind? Anybody? Most of the time, whenever these type of symptoms come, I prescribe one or two remedies. One remedy is very important that you have to understand. Whenever in emotions or because of emotions, the complaints are increased, what do you think about? Anybody? See, these symptoms a patient cannot lie, because this is the body's reaction is so important. Or you can say, when the patient vomits, there is blood in expectoration. You ask the patient, how is the blood? It is red, it is clotted, it is black, it is brown, and it is streaked, it is stringy. Now this symptom of body will never lie, and that's why our prescriptions basically ignitia. Okay. Whenever it is because of emotion, and that's why I always keep telling that whenever you are studying Mater Medica, aphorism number 6 is so important. So unprudence observer, everything related to emotions, we have very important remedies. We have aconite, we have ignitia, we have natrum mur, we have acid phos, we have these remedies. But sometimes just try to think beyond these remedies also. One remedy, two remedies so important. The first I use lots in my practice, and that is guaiacum. Please write down in your Mater Medica, guaiacum. And the second remedy again, which is very commonly prescribed for arthritis or for joint pains, and that is bryonia. So these two remedies I have found very useful clinically in my practice, which I have used when the pain in the extremities, whether generalized or specific, is aggravated because of the emotions. These are called as non-verbal communications. which I hope you understood something, because these are things which you must know, that so that you are able to get into that remedy, enter the case very easily. Okay, so I do welcome Dr. Amol, Dr. Alexandra, Dr. Vinugopal, Dr. Vaishnav, Dr. Bava, Dr. Madan, and Dr. Padmaja. These are yeah, Guaiacum and Bryonia. But I have used Guaiacum so many times in my practice. It's a very interesting remedy. It's a very important remedy, and I think I have discussed this remedy so many times in my webinars and all. So I think you must know some symptoms of Guaiacum. Anybody? Very important symptoms of Guaiacum, which you have to understand if you want to prescribe Guaiacum for maybe arthritis, maybe joint pain. There are some very important symptoms. Anybody? Do you remember what I discussed? Yes, gout, rheumatic pain, but those are basically a generalized answer. If you want to prescribe Guaiacum, very precise symptoms of Guaiacum that I use in my practice, and I have got good results with that. Foul secretion, yes. Anything else? He must stretch. Yeah, this is again a very important symptom. He must stretch. Stretching the patient requires is again a very important symptom of Guaiacum. Anything else? Anything else? Perspiration on face while walking in the open air. Okay, I might not have prescribed Guaiacum for this symptom, but it might be backache by walking. Okay, whenever we find you have to use Guaiacum, one symptoms basically I have seen in many of patients. In fact, all the patient I have seen that the legs are very heavy. The legs are very heavy, and the patient comes and tells you, I have to catch my leg and move here. I have to catch my leg and move there. That is Guaiacum. I have seen in so many cases in my practice, in case of Guaiacum, where the patient comes and tells you the legs are very heavy. That, of course, those symptoms of stretching are there, but this symptom I have found so many times in my practice. So these are very important symptoms, very interesting symptoms of the remedy. Yeah, all pain, stiffness, arthritis is there in Guaiacum, but those symptoms which are very important that I have seen, I am basically discussing in front of you, because this is only my clinical orientation which I give. I have not in Mater Medica there are so many symptoms. If I start, I will have Guaiacum so many times, but these symptoms I have seen in my practice, and I use Guaiacum in lower potency. Have you understood something about the non-verbal communication? Because we already have a lot of questions. So before that, I would like to at least apple aversion, pain in the eyebrows. Yes, that is also there. Dr. Vishaka. Hello, Dr. Elisa. So these are symptoms of Guaiacum. Let us forget Guaiacum now. We have a question. I hope you understood something about the nuggets, means the non-verbal communication. Those are so important. Look at the hairs. I told something about the hairs, the eyes, the face, the skin, the ears. Now I am only discussing what is there in the books. There are some symptoms, there are some non-verbal communication in which I have used remedies which symptoms are not there in the Mater Medica nor in the repertory. Those are my clinical observations which I have seen in my practice. So in that you may have a lot of questions that we have not seen or it is not given in books. I know that, but that's why I'm not sharing what is not there, because we are just trying to discuss what is there in the books, and we sometimes don't look at those symptoms. Okay, I have some symptoms I'll discuss sometimes later, non-verbal communication remedies which I have seen with some symptoms not present in books, nor in the repertory, nor in the Mater Medica, but today I'm only discussing about in the books. Okay, so non-verbal communication can also involve the body segments, the nails, the skin around the nails, anything basically which tries to describe the patient's personality. Good afternoon, Dr. Elisa. So one question from Dr. Madan. Female patient says she must work in office too much, so others will criticize, and she feels and has fear there. Yeah, I think this was a question which basically I think asked in the last YouTube also. So this is a case where the patient feels that her esteem, her identity is only when the patient works. So her basically identity is working, and if she feels if she does not work, then she does not have identity, and people will start criticizing her because of that. Why I'm using the word identity? Because every patient that comes to you wants to create an identity. For example, a patient comes and tells you, sir, I have basically a problem that whenever I'm going out, no, I have to have everything neat and clean. And immediately his associate come and tell us, sir, he has a problem, wants everything neat and clean, keep on cleaning. So that identity of cleaning is made by that personality. So this personality basically wants to create identity by working, because he or she feels that if she does not work, people will criticize her. Of course, there's a lack of confidence. The patient is timid. The patient is introvert. The patient is reserved. Cannot share her feelings. Is not bold. Is not courageous, because she's always worried that what will happen if I don't work and people start criticizing me. So she has created her identity by, or she wants to make people happy or recognize her by her work. Now, in this case, you have to differentiate whether physical work or mental work. We have remedies where the patient desires mental work like bromium, like tarantula, like pulsatilla, like natramur. These are remedies which require mental work. But there are also remedies which say that if you just want to work, I cannot sit idle and work up and down, I cannot rest. I can do gym, but I can't do yoga. No, those are personalities. So this case, the remedy changes. But if you only take in this case mental work, and you can have remedies, a lot of remedies like I told you bromium, I told you something tarantula, we have sulfur also, we have natramur, we have pulsatilla, lot of remedies. Then in this case, you have to be very important to understand what was the sora of the patient. Understand the sora, no? Was he so cautious? Had he that conspicuous behavior when he was a child, that he used to complete the schoolwork properly, or what will the teacher say? Always behaving very tidy, neat in the class, no talking, because he was always worried, will the teacher scold me? So if that constitution has been followed from the school life till now, then that becomes a very, very important and prescribing symptoms of that personality. I hope you got some inputs, Dr. Madan. Sir, I have recently ordered your COVID-19 for a doctor who is an anxiety medicine. Now, the doctor wants to know if the anxiety pills can be stopped, as the COVID nosud is being taken now. No, you see, basically what happens, and for how long? Theory of miasms. I'll ask Dr. I'll just first tell Dr. Sigma. No, if the patient basically is taking medicines for anxiety post-COVID, and you have given the medicines that COVID-19, so just wait for at least a week and understand and see how is the medicine working. It is not that every case where the patient had COVID and after that the symptom developed, every case is basically working or doing well with COVID-19. It is not like that. Symptom similarity, if it is very precise to a particular constitutional medicine, then you prescribe that constitutional medicine. But if you find it is a vague symptom, maze of symptom, everything because of COVID, and no symptom peculiarity, you have got PQRS, then you can give COVID-19 maybe as an intercurrent also, or bad effects of COVID disease or vaccination, then you can prescribe COVID-19. Wait for a week and then start tapering the medicines. Okay. On WhatsApp, I got a message that you are going to discuss about related theory of miasms. Yeah, that basically we were trying to discuss on the Google Meet, which is a long process. So we are making arrangement from there. I was expecting something from Dr. Amit, that he was doing some arrangement for Google for that Google Meet. But because miasm is a very big topic, and sora, psychosis, syphilis, basically you have to differentiate those miasm according to the patient's history and the symptoms of miasm. For example, if you're taking a case of cancer, so you have to have some syphilitic inputs from the patient's history, so that you can enter the case through that syphilitic symptom and not a soric symptom. Which remedies do you suggest apart from Midorina and Millennium tick come in your mind for a patient very sensitive to criticism, feels it like a blow? Now see, whenever you are prescribing medicines for criticism, there are so many remedies. In fact, first of all, criticism and all these symptoms, basically I feel the remedy has to be from cases where the patient has lack of confidence. And then you can go further whether that symptom is present in the psoric stage or the psychotic stage or the syphilitic stage also. Get me? Now, sensitive to criticism, you can, if you open the Mater Medica, in fact, Medorinum and what you have written, Lilium tig. These two remedies, in fact, I have used very less when there is these symptoms of uh, criticism. There are some remedies. For example, if I would like to add the first remedy that you should think about is carcinosin. Carcinosin I have found useful in so many cases where the patient is sensitive to criticism. The first remedy that normally I think is carcinosin. I hope you. So if you basically have patients where the patient is very sensitive to that, first I basically think about carcinosin. Second, I think about arsenic. Third, I think about sulfur, and fourth, or you can say these are basically remedies which I have seen in clinical in my practice. But if you go by Mater Medica, I would suggest do these type of remedies. First is carcinosin, what I have seen in my practice. Second is saccharum alb, sugarcane. Third, I would give importance to pulsatilla, and surprisingly, the fourth remedy that I give importance to is Nux vomica. Very sensitive to criticism. Medorinum and which remedy? Lilium tig. I have used very sporadically and rarely with these type of symptoms. The doctor had anxiety after doctor had COVID vaccine too. Yeah. So Dr. Sangma, yes. So welcome Dr. Meera. Dr. Sangma, so in this case you can prescribe COVID-19 about give 2 doses, 1 dose in the night and 1 dose in the morning. After 3 days, you will find some change. So start tapering of the medicines and you can automatically taper within week or 10 days time. Okay. I have something on my Instagram question, so I'll just take that question first. Yeah, thank you. So I hope Dr. Alexandra, you understood something about these symptoms, because normally see people don't think about Nux vomica because Nux vomica has been plated as very has to do things by hook or by crook, very industrious, wants to complete the work and so fast everything. But Nux vomica also has these type of symptoms which are so very important. For example, when I was teaching platina last time in the seminar, I was taking a seminar and dealing cases. Some symptoms I told about the case of the platina, which was so interesting and something new to the audience. And we had a wonderful offline seminar yesterday, full capacity, and it was such a nice feeling to be sometimes offline, because of COVID, we had everything online. So we had offline and it was a fantastic seminar. As whatever I taught, I felt good from inside that I was teaching something very special. We discussed some cases also, and these nonverbal communication symptoms, lot of symptoms were discussed there also. So saccharum alb, Nux vomica, pulsatilla, carcinosin, important remedies which I have used in these type of cases of criticism. I will ask the progress and give the report. Yes. What to give for growing abdominal hernia from daily yoga exercise over many years? See, if the patient has gradual or growing abdominal hernia from daily yoga exercise, means there is an inflammatory process, and inflammatory process is there and the patient is doing yoga. So it will again increase the inflammation, no? So tell the patient basically to minimize the yoga so that that inflammatory process is not triggered or aggravated. Only then you'll be able to try to cure or treat that case of hernia. Every time with medicines, at least tell the patient something about the auxiliary measures of treatment. It is like the patient is having pain in the arm, you are giving medicines, but he cannot stop playing cricket or throw ball. That sometimes will have a long time in healing, or sometimes it will not heal only because the maintaining cause is still there. So if there is a maintaining cause, make sure that that is taken care of for some time, and then you can treat that hernia. Loss of beard in 22 years, what should I give? See, loss of beard, basically barber's itch. Now, whenever these are very common, these are very common problems, like barber's itch and all. And of course, there are some specific medicines for barber's itch and all. So you can definitely write down something for barber's itch. But again, for me, if you ask something about barber's itch, it's like ringworm, itching ringworm on the beard. And the most important remedies, Dr. Meera, in this case, you should think about what I give in my practice is, that's what I'm sharing. Thuja is the first remedy, second Staphysagrea, third Lycopodium, fourth Calcarea, and fifth nitric acid. So these 5 remedies, try to confirm with some few other symptoms of these remedies, and you can prescribe in case of barber's itch. Sir, please share experience on peripheral neuropathy and which medicine to prescribe. See, peripheral neuropathy. First of all, you have the cause of peripheral neuropathy is in most of the cases is diabetes. So in diabetes mellitus, if in long cases of diabetes where the patient has diabetes and is taking a lot of antihypertensive medicines, because of that the patient is getting neuropathy. Now, if this case comes to me, my approach would be at least to treat the sugar, to treat the diabetes and try to reduce that level of sugar to a place where the peripheral circulation starts properly. But now there are some doctors who only want to treat that neuropathy, give some tonics to some that part to the patient so that only the neuropathy is taken care of. So there are some medicines which might improve sometimes, which works like vitamins in our body. The first thing you must think about is lecithin. No diabetes. Lecithin you can think about. You can think about ginkgo biloba. You can think about Avena sativa, or you can think about remedy Gymnema sylvestre. These are 4 remedies which I have used lots in my practice for neuropathy years back. When there is no cause, then you have to think about these remedies. Lecithin, Avena, ginkgo biloba I have used lots in my practice in low potencies with repetition, and that has given me good results. Or you can think about Theosinaminium. That also will give you good results. Does homeopathy help patients suffering from postural orthostatic tachycardia syndrome, which results from dysfunction of the autonomic controls over heart rate and BP? Yeah. See, the question which I have asked is such a very interesting question and a very nice question. The answer lies in that only. That is autonomic control. So in this case, you have to ask in case taking, what are the things that the patient wants to take care of, or the patient wants to settle in the mind but is not able to do so, and those thoughts keep coming in the mind, and because the patient is timid and patient is reserved, it keeps affecting his heart. He has palpitation, he has perspiration, he has anxiety. Those symptoms, if you take for prescription, 1 or 2 syphilitic symptoms can give you good results in this type of condition. Dr. Mol, very good question. Which remedy comes to your mind for a very dry hacking cough? Dry. Dr. Manisha has joined. Thank you on the Instagram. Very hacking cough, hard expectoration only in the morning and scanty during day. Aggravation by talking and sounds like spongia. If it is sounding like spongia, then give spongia. It is so dry, hawking, and if you feel it is it is sounding like spongia, to give spongia, I would say, because a spongia also has dry cough. Spongia has everything what you have told, but still, see, whenever a patient comes to you for dry cough, especially in the morning, so normally there are 3-4 remedies which that comes to my mind. Of course, spongia is there. 3-4 remedies that you should think about in these type of cases. Of course, Rumex crispus, Squilla, Phosphorus, and Kali Ars. Very, very important. And these remedies, basically, if you see, have very dry, hard, racking cough on waking in the morning, and gradually they have expectoration then, and then automatically the patient starts getting better with the expectoration. So these 5-6 remedies I have used so many in my practice, and that have given me very good results. So you can try those. Of course, if the cough is sounding like sponger, then you do give sponger. Intertonatic femur fracture surgery or homeopathy. If it's a hairline fracture, you can ask the patient Dr. Singh to take rest, and in this case you can prescribe some remedies like symphytum is there, calcareous is there, ruta is there. These remedies have given definitely good results. I would say I have not treated any case of intratrochanteric fracture in my practice, but I've treated a lot of cases of hairline fracture of tibia, of the malleolus and all. I have advised patient rest, and these medicines in lower potency repetition, I have repeated the X-ray and they have shown good results. But intratrochanteric fracture I have not seen. So if hairline you can try, but if it's not hairline, then I would suggest surgery. Okay, great. Just give just in case it doesn't work. Okay. The main modality is aggravated talking. Yeah. Okay. Yeah. See, if you talking, what happens? See, I'll tell you some implied symptoms of talking. Whenever the patient is talking, so it is not only cough because of talking. Sometimes when you talk, this becomes very dry. The throat becomes very dry. So whenever the patient has a cough exactly from talking, especially when the talks very loud, then you can think about argentum nitricum, phosphorus, and tuberculinum. But the patient says just by little talking, the cough is dry. Then you can think about Drosera, Sanicula, Rumex, or you can think about Hyoscyamus also. One remedy when the cough is so dry that the patient whispers. I had 3 or 4 instances where I had used this remedy with fantastic results. Dry so much that the patient has to whisper, and the remedy was pulsatilla. Okay. There are some questions on Instagram also. I'll take those questions also. Why homeopathy medicine is so cheap? Doctors are costly. Okay. Sir, which medicines follow Staphylococcus aureus? Well, we have patients who responded to Staphylococcus aureus very well on the mental condition. Now she has opened up to. Now see, of course, in our practice, basically, if you open Borix Matermedica, there are some there is a section where it is written follows well by and this and that. In my practice, whatever I am doing, there are few remedies which I take and see the follow-ups and all. But if you feel that you have given Staphylococcus aureus, of course, and you feel that there is a block and the patient is not able to get relief beyond Staphylococcus aureus, so in this case you sometimes have to think about some intercurrent remedy or something like it is written in organ of medicine. Something is blocking the way of cure. It can be a simple diet also, which is blocking the way of cure. In that case, you can try an intercurrent remedy, or it is written in few remedies. There's a one symptom, beautiful symptoms in a Matermedica, that when the best selected remedy fails to give result, then you must think about that remedy. Sulfur is there, soranum is there. So in this case, if you ask me that remedies which follow after Staphylococcus aureus or the remedies which are complementary to Staphylococcus aureus, whatever I have seen in my practice, Nux vomica is there, Clostridium is there. But I would not use that part, because I would see why there is a blockage in the cure, and first ascertain that blockage and then go forward. Okay, so in this case, it is important to understand the blockage of cure, and then if you prescribe, it would be better, I feel. Good afternoon, Dr. Amit. I had a beautiful case of COVID that there was cough, and the patient said there was a lot of mucus that could not bring it up or down, and gave Yucca filamentosa. Yeah. Again, Yucca filamentosa, again, I hope you must have, or if you have not, I think I have put Yucca filamentosa in my YouTube for cough. I think long back. If you see also, I hope some symptoms of Yucca filamentosa should match because yucca is such a wonderful remedy, for cough, and it is almost specific. When there are few symptoms, it matches with that symptom. For example, if you want to prescribe yucca, of course, Dr. Alexandra would share her experience more than, because she has got a very good experience with that. But yucca again is such a fantastic remedy, for cough. And if you go and see the mathematics of yucca filamentous, you will find I had seen a lot of cases where the yucca filamentous patient has taste in mouth as if it was of rotten eggs, and that has led me to prescribe so many cases of yucca filamentous. I know. Welcome, Dr. Gurvinder Sonkusreji. Welcome. So can you, if we get time, we'll see some symptoms of yucca filamentous. So what I think, Dr. Alexander, yeah, with stingy ropey mucus and got excellent results. And yes, I got it from your teaching. Yeah, thank you so much. Explain Ella's mouth broken eggs. Oh, no, I did not get your question, Dr. Robbins. So if you can put that question properly, because I could not get that question. Okay, yucca. Okay, for yucca, yes. So I had a lot of cases where the taste of rotten eggs and very close to a remedy called Arnica montana. Yes, so can we have few questions have been scrolled up, because I took some time to answer some questions. Yeah, so if you have missed out on some answers, you can again write the question. On Instagram also few questions are there which are unanswered, so I'll take those questions first. Taste in the mouth of rotten eggs, yeah. Now see such a fantastic thing, when there's a taste in the mouth of rotten eggs, rotten eggs. Now I'll just come to that. Whenever there is taste in the mouth of rotten eggs with cough, then you have to think about a very, very polycust remedy, and that is, I think, sepia. But if the egg tastes like rotten, then the remedy changes. Then you have arnica, you have yucca, you have nux vomica, you have pulsatilla, and you have muriatic acid and mercurous also. But taste like rotten eggs with cough, remember and write down in your Mathematica, the remedy is sepia. A very, very interesting case I had where I used so many remedies for cough. I used 3-4 remedies chain, but it was not working. Then the patient told me, because of this cough, itna khas liya, I have coughed so much, nothing is working now. With that cough, I have a very egg-like taste ke anda sada hua hai, like rotten egg taste. And immediately from the Mathematica, I had read somewhere it was sepia. I prescribed sepia, and the patient came out. That rotten egg smell is such a very, very common smell. Sometimes you go and the patient has most of the time, no, it is not theoretical, it is practical. Whatever I am basically talking to you is whatever I have seen in my practice. So it is not theoretical, it's clinical. I never talk theoretical. The patient comes and tells you, मेरे खांसी में से बहुत बास आ रही है. Then he, depending on the class of the patient that is visiting you in the clinic, they will decide, he said अंडे के समान बास आ रही है. And egg is such a commodity that everybody has tasted and smelled. That's why that symptom I have seen in so many cases. Of course, I don't ask, like for instance, people have taste like, people have said the perspiration is smelling like sulfur or onions. I never take that, because I take a grand rubric that perspiration is offensive, because it's sometimes become difficult. So that's why these tastes, which are very, very common, are very, very commonly seen in a practice, and I've seen this type of taste. So whenever you are prescribing a medicine and that taste is such a 3 marking and a very, very identifying feature of the patient, take that. X-rays are normal, no history of any comorbidity. Which case, Dr. Meera? Dr. Meera, have you basically told, asked some question before, because patient has pterygium skin going from corner into the center. Yeah, you see, I think this question also was okay. So Dr. Meera has answered that question of pterygium. Okay, I'll take that question first. See, pterygium basically what happens. I had, frankly speaking, I had very few chances of teaching basically having treating a case of pterygium. Whatever mathematica I understand about pterygium, I have not seen those cases from center to from what you call corner of the eye to center. So I will just basically give some remedies which I have used in my practice, and very common remedy that is written in a mathematica. You have read also everywhere. When the pterygium is pink in color, I have used argentum nitricum. But from the center, what you are asked from the corner to into center of the eye, I have never treated a case of that. So I don't want to answer this question because I have got no results. I have got only few results where the pterygium was pink in color with argentum nitricum, and I think one case where I used zincum metallicum and sulfur in one case of pterygium. So not much experience in treating that type of symptom, Dr. Province. Mr. Farman from Instagram have joined. Welcome. Next question. "56-year-old lady unable to move her right hand. It's jammed. Since 3 months, I have given Belisper, Ruta, few." So right hand basically, it appears that if he or she is not able to move, so is it frozen shoulder? Please confirm that. Okay, right hand. Because in frozen shoulder it is encapsulated because there is a lot of fibrosis in fibrosis. So in that case, it is very important. First of all, whatever I advise to the patient is, see, physiotherapy also is an important. In these type of cases, when there is a lot of, see, we get a lot of patients of neck pain, the spasm of trapezius muscle. Of course, medicine would help, but physiotherapy also to release the spasm is so important to tell the patient in this type of condition. In right hand, so there may be a lot of remedies where we can prescribe this. In this case, we have, I think, exhausted all the remedies which cover. You have given Belisper, you have given Ruta, yeah. So these are very common medicines, and I think you have already given the medicine with no change. Now again, if there is no pathology involved and still the patient is carrying a pain, first of all, I would suggest that the patient should basically go for physiotherapy. Second, right hand pain. If you have seen basically in cases where right hand is affected, the right hand has become very stiff, there are some remedies which are very important. Causticum, Colophyllum, Calmia, Sanguinaria, Strychnum fos, and Colchicum. These are the 5 remedies which I feel, whatever I can recollect from the knowledge of mathematica. Gynecomastia. Gynecomastia, I have got, I would say I have not got so many patients of gynecomastia of late. Previously, I used to get a lot of cases of maybe it's not coming, maybe because they're going to other doctors. Gynecomastia, I have got very less experience, but Strychnum fos, Strychnum, Strychnum fos. So in gynecomastia, whatever medicines I have used in my practice, first is Phytoleuca. Second, Rustox. Third, Conium. Fourth, Calcarea fos. And fifth, Ferrum iode. These are the remedies which I have used in my clinic for gynecomastia, and I would say I've got fairly good results. It's basically growing patterns in males, and of course in males who are maybe 25, 30, 40. This basically with the medicine, I also tell the patient to do some what you call gym exercise or some aerobic exercise so that the muscles basically become stiff, and it works better in those cases. Only by giving for medicine for gynecomastia at 25, 30 years of age, I have not seen good results. But at puberty age, I use this medicine with good results. Yes. Next question. Try some medicines. Okay. Can we go further? Few questions have gone up. It's already 3:57. 3 minutes to go. Instagram live. Few questions where, yeah, of course, there are some. It's one again a good question in Instagram. See, sometimes it was basically for taste only. So there are some taste, taste like faces like I have not seen in my practice. Like taste like faces or taste like fatty taste, greasy taste. I have not seen in my practice. Theoretically, I can answer there are the remedies which are there, but basically you can take very, very putrid taste, offensive taste, and you can have then group of remedies and at least some group of remedies where the taste is very offensive, putrid, and like pus type taste, and then you can enter the case. But faces like I have not seen in my practice. Diabetes and hypertension patient, no urging for stools since last 2 days. Taken brine alumina but no effect. You suggest please. No urging for stools. Okay. So inactivity of rectum or inertia of rectum, you can think about platina, you can think about selenium, and you can think about thuja. Pain in lower back, left side from overuse of muscles. Overuse of muscles means the muscles have been stretched too much, so it may be a spasm or a sprain. You can think about Rustox, or you can think about Bellispur, or you can think about Macphos. These are the basic remedies, and of course, the constitution is that type of stretching. Every time he stretches mentally and physically, think about a Kali also. Does homeopathy help with patients has fat herniation of lower eyelid? No. So, Dr. Amul, I have not got these type of patients in my practice, so I cannot comment on this. Okay. Next. So I think there is 1 minute left, so we can take one more question before we close the session. See, some taste basically in Instagram people are asking taste. So basic taste basically I see bloody taste or salty taste or offensive taste, putrid taste, rotten eggs. These are the tastes which are easily understood and appreciated by the patient. So it is very easy for the patient to describe and for the doctors to understand. So these basic tastes, which is very easy to appreciate, I take that for my in my practice. Inertia from heat. Is there a remedy? Inertia from heat. No, I've actually not understood the question, Dr. Lisa. Inertia from heat. So can you elaborate on that question? Uterine prolapse after constipation. After constipation, if there's prolapse, there are remedies. Just a minute. I'll just finish that question first. When it is too hot, there is a remedy for. When it is too hot, is there a remedy for inertia? No, I have not used that, and I have not got this symptom from any patient. So there may be remedy, but I have not used those remedies. Okay. For prolapse, you can think about ruta, you can think about podophyllum, you can think about bryonia, you can think about nitric acid. Okay. So I think it's already 4 o'clock, and thank you everybody. Thank you for joining. Until we meet next time, thank you.